Okay, we talk about CNS depressants a lot on this podcast, and why do you think we do that? There's a couple of reasons. First of all, they're used extensively in the hospital for pain control, and second of all, the NCLEX really wants to know if you're going to be a safe nurse, and there's some very important considerations when you're giving a patient opiates that you just have to keep in mind, not just for the NCLEX, but for your life as a nurse, okay? So today we're going to talk about codeine, trade name Paveral, okay? You're going to hear it as codeine. That's what people call it. That's what it's commonly known as. It's given for management of pain, also given for diarrhea and cough suppressant, okay? A lot of times what you're going to see it given for is pain, but one thing that tests will like to trick you up on is you need to understand it's also given for a cough suppressant, and so that's kind of a side effect. That's also something you kind of need to keep in mind as you're giving this medication. How does it work? Like other opioid agonists, it works by binding to opiate receptors in the CNS and altering perception of pain while producing a general depression of the CNS, okay? And this general depression of the CNS can also cause a decrease in the cough reflex and GI motility. Okay, so that's kind of how it's going to work. That's why it's going to cause those other effects as well. So therapeutic class, allergy, cold, cough remedy, antitussive, and opioid analgesic. Again, big ones to keep in mind: opioid analgesic, antitussive, and then allergy, cold, cough remedy. Pharmacologic class is opioid agonist. Like I said, big things to keep in mind here. You're going to absolutely just have to keep in mind that you have to assess blood pressure, pulse, and respiratory rate prior to administration and frequently during administration. It's very common for these patients to, and especially if it's your first time to give one of these medications to a patient, you just have to know what's going to happen, okay? If you don't know how this patient reacts to this medication, you need to be there, you need to be close, you need to be monitoring this patient to make sure that they don't have an adverse effect. For example, we have had patients that we've given, and this is, I'm not talking codeine here, but like we've given first dose Ativan to, never given it to them before. A couple seconds later, their respiratory rates bottomed out, their heart rate's bottoming out, and we have to get them in ICU really quickly and kind of monitor them more closely, get them back to a stable condition. Now let's talk opioid agonists. What are we going to give them if this does happen? Okay, for your opiates, what are you giving to reverse? What's the antidote? Okay, what are you giving? You should be thinking Narcan or naloxone. That's the name of it. This is the antidote for opioid agonists. Okay, a couple other things to keep in mind. This may cause alterations in mentation. Again, we talked about hypotension. It can cause constipation. Remember, we're giving it. If we're giving it for pain, remember, it can slow GI motility as well, so it can cause constipation. We want to use extreme caution in patients receiving MAOIs, these monoamine oxidase inhibitors. And then, again, really just monitor your respirations, your cardiovascular status, and everything as you're giving these medications to these patients. That is codeine. It has a lot of the same kind of things, nursing considerations you need to keep in mind with all of your opiates, okay? This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.